and welcome to the June 2024 Pitt County Department of Social Services Board meeting. I would like to call the meeting to order and observe a moment of silence. Thank you. Are there any revisions to today's agenda?
I make a motion that we add closed session.
I second.
All in favor?
Aye.
Aye.
Do we have any public comments today?
No, sir.
All right, you all should have received last month's minutes. Are there any revisions to last month's minutes?
I move to approve.
Second.
Any discussions? All in favor?
Aye.
Aye.
All right, so next we'll have the new hire and retiree recognitions.
We don't have any retirees, but we'll, might come so closer so you can hear me. For those folks that are here that are new hires, when I call your name, if you could come up to the podium, make sure that you speak into the microphone and just introduce yourself, what part of the Department of Social Services you're working for, and if you're comfortable, a little bit about yourself. Okay. Ferdicia Barber. Welcome.
I would have to be first one. Hi, my name is Ferdicia Barber. I started on May the 13th with Family and Children Medicaid under Cleavon Hunter. And I'm an income case maintenance caseworker.
Welcome.
Thank you, welcome aboard.
Constance Williams.
Constance, not
No,
here.
not here, no. Rivian Velez. And I apologize if I did
No,
not.
you actually said it correctly. It's
I
Ravian
did.
Velez, yes.
Wonderful.
So my name is Ravian Velez. I'm with FNS Intake, and I am excited to be working with Department of Social Services.
Wonderful. Thank you.
Glad to have you.
Good to have you.
Katrina Moore. Good afternoon, Katrina.
I am Katrina Moore, and I am with the Intake Family and Children Medicaid.
Thank you.
Welcome aboard.
Netzia Suggs.
Hello, my name is Natizia Suggs, and I'm with Income Maintenance Caseworker 1 in Customer Care.
Thank you. Welcome.
Welcome aboard.
Good to have you.
Mia Bishop Jones.
My name is Mia Bishop Jones, and I'm with Family and Children Medicaid Intake.
Welcome. Thank
Welcome aboard.
Howdy.
Adriana Ordonez.
Hi, I'm Adriana Ordonez, and I am with FNS doing read a term.
Hi. Welcome aboard.
Welcome aboard.
Jessica Deans. Hello, Jessica.
Hello, I'm Jessica Deans. I'm an office assistant with the Child Support Division.
Welcome.
Welcome
Thank
aboard.
you.
Welcome.
William Brown.
Oh, we got a guy in the group?
Oh, he's a return partner. Miss
Oh, how wonderful.
Yeah, you do, but that's okay. Well,
Hey, how y'all doing? Sorry, I lost my voice coaching football this weekend. I coach youth football, but my name is Will Brown. I'm a rehire. I came from Guardianship Adult Services, and now I'm with Child Welfare and Home Services. A little bit about myself is not too many people in Pitt County that do not know me. And I've been with Pitt County for about 10 years, whether it was with the school system or with the local government. So I'm glad to be here. And Ms. Sharon Rochelle is great.
Aw, thanks.
Thank you. That's nice to hear.
Dominique Smith? Hi, Dominique.
I'm Dominique Smith. I'm in.
Wait a minute, I won't hear.
Is that's better?
That's a better.
Okay. I'm Dominique Smith. I'm in child welfare in assessments. I'm a new graduate with my MSW.
Congratulations.
Hey, welcome. Now, that's wonderful. We want you to stay forever.
All right, welcome aboard all new hires. You all are welcome to stay, or you can be dismissed. Next, we're going to have the Department Spotlight, Family Support Services.
I'm sorry, Mr. Chair.
Good afternoon.
Hi, Sonia.
My name is Sonia Scott. I am the Administrator for Family Support Services. And just want to give you a little spotlight about Family Support Services. But before I begin today, I decided to do something a little different. Instead of me speaking, I have my supervisors to speak, give you an opportunity for the board and the public to see the actual supervisors, the awesome team of supervisors of the Family Support Services Division. But just briefly about Family Support Services, the services that we provide is used to help relieve or eliminate economic stress on families by promoting them to become self-sufficient. Those programs include crisis intervention, non-emergency Medicaid transportation, daycare, employment services, and child support. So first we'll have employment services, and that unit consists of 57 staff members. Even though the division is small as a whole, I would say that we are mighty in the work that we do, in the quantity of work that we do, quality and quantity of the work we do, and the success of each of the programs. So I'll call the employment services supervisor up first, Shavonda Perkins Ormans, to tell you a little bit about employment services. I didn't know I was going to be first. Miss Mary, can you hear me?
Oh, thank you, honey. Yeah.
All right.
There you go.
So I'm not going to read the slide. I'm just going to give you some information. So again, I'm Shavonda Perkins Orman, and under the Employment Services Division, I have 3 programs. The first program is FNS Employment and Training. I also have Work First Employment, and I have the STEP program. The STEP program is supporting, training, and employing parents program under the child support program. The purpose of these programs is to assist qualifying recipients with obtaining employment, gaining skills, training, work, and other experience that will increase self-sufficiency. So some of the things that we do is we help them to obtain employment, we send them to school. If they're looking for work, we help them to become more employable. Some of the other things that we do is we help them to job search. We help them to explore careers. We give them skills training, resume writing, and education support. We also pay for them to go to school, which is short-term, and we also offer them short-term transportation. So far this year, we have 60 participants that have gained employment and are no longer receiving assistance. Since January, we have 23 participants that have received certification. So when I say certification, they have obtained things like their NA1 certification, NA2 certification, pharmacy tech, and things of that sort. Also, we have one participant who is working for First Source, and he is making $21 an hour. We also have another participant who is doing lawn care work, and he's making $100 a day. Um,
Oh, my.
One success story is we have a participant that came in who was a substitute teacher, and she decided to take the NA1 certification, and she's now working with Health Pro. And another success story is we have a daughter and mom that decided to take the NA1 class together, and they both passed.
Oh, that's great.
And I'm gonna let you all read these participant statements that they sent to us. They were just some thank yous and them telling us about how they felt about our program.
Great.
Awesome, thank you.
Thank you. And Shavonda does keep me on my toes. So now we'll have Ms. Abba Jones Hopkins to come up to speak up about child daycare services.
Good afternoon. My name is Alva Jones Hopkins, and I work with the Child Care Subsidy Program. Child Care Subsidy is basically in place to assist our families in the community with obtaining child care, assistance for their children, obtaining child care for their children, and maintaining employment, training, or job search activities. I have some statistical information to give to you, so I'm going to review what's on the slide. I will let you know that our unit is comprised of 4 social workers and 5 income maintenance caseworkers. The information on the slide gives you information about our expenditures. Currently, our total allocation is $12,676,839. The total amount that has been spent thus far is $9,492,536. The remaining balance is $3,184,302. Our current spending coefficient is 92.84%, and this represents March services for April payments. To give you information in regards to the children that we serve, the total children served as of April 24 has been 1,812 children. Our wait list as of July 2023 totaled 1,298 children. The children added since July 2023 totaled 766 children. The wait list as of June 2024, and I'm proud to state this, is approximately 414 children. So you can see that as a substantial decrease from what we previously had in the year of 2023. And this largely is as a result of the increase in our staff to help us complete those applications and get those services out to the community. The wait list the notifications have been sent out also for 200 families in the month of June, and that is going to serve 289 children.
Awesome, thank you.
Thank you.
And I'd just like to iterate, in October when we presented on child care, we had the highest wait list in the state of North Carolina. Under the leadership of Ms. Rochelle, we were able to obtain 4 additional positions. So as you can see, the result of that has caused us to reduce that wait list. And even though the wait list right now is 415, staff sent out 289 invites on June, just this week. So, last week. And those are due back July 3rd. So when those are removed for those lists, we'll be under 200. Of course, we'll have some that will be added to the wait list for the month. But our projection in October was for the summer of 2024 to have our wait list depleted, and we are on track to have that done. And that's thanks to Ms. Alba Jones Hopkins and her awesome staff of the Child Care Division. Even though she's not speaking today, I want to acknowledge Ms. Hill. Ms. Hill is our program manager for child daycare services and employment services. They are located in the annex, which is a building behind the Human Services Center, and she is pretty solely responsible for that entire building, and she does a great job. So if you could just stand, Ms. Hill. She's gonna get me later. And next we'll have Ms. Sheila Farrell. She is the supervisor of our crisis intervention program and non-emergency Medicaid transportation.
What an outfit.
Thank you. Hi, my name is Sheila Fair, and I can say that I am newly 1 year in as being a supervisor.
Congratulations.
Thank you. I am the supervisor of the Crisis Intervention Program, and I'm also the supervisor of the non-emergency Medicaid transportation. And I'm going to read off the screen, if you can look at your screen and see, because like I said, I'm new to all of this. But as our official year starts from July the 1st, 2023, and it ends June the 30th, 2024. If you look at our total allocation is $727,590.01. Too far? Oh. And then you can look at the total issue obligated was $7,590.01. So it tells you we are at zero balance. We have allocated all our SIP funding for the official year.
Wow.
The total household approved were 4,913, and total households denied were 3,436. Next screen is emergency services, 200%. Official year is the same, starting from July the 1st, 2023, ends on June 30th, 2024. Total allocation funding for that was $35,000. Total issued and obligated was $33,404.73. We do have a total remaining balance, might be a little bit lower as of today, as $1,595.27. We have approved 117 cases, and we have denied 360. And for our non-emergency,
And I just want to say with our SIP funding, we actually exhausted all of our SIP funds on February 27th of 2024. And as far as our 200%, which is a program that helps with evictions, we exhausted those funds in December of 2023. We did receive additional ARPA funds from the planning department. We received $150,000 from the planning department to be used for eviction and utilities. And those fundings started January 1st. Since then, we have already issued $140,000, $140,000 plus dollars, and our administrative fees for our temporary staff was $8,710.96. I will tell you that has changed since this PowerPoint was created. I think right now we're right under $10,000 of what we have remaining. I am fortunate that we are fortunate that we received those funds, because otherwise we would not have been able to help our citizens here in Pitt County. So I'm not really sure how funding will last the next fiscal year, because there has been changes to policy, but hopefully we will receive some additional funding from somewhere else. And so I'll let Ms. Farrell talk about non-emergency Medicaid transportation.
Sonia, can I put you on the spot for a minute?
Yes.
So I think between those two programs, between the 200%, it might just be interesting to talk about the approval process, because we really aren't able to meet the needs of a lot of folks. And if it wasn't for the ARPA money, we probably wouldn't have been able to do as much as we did this year.
That's correct. With the 200% program, that is a part of the TANF program, and it helps with eviction, but one of the requirements that eliminates a lot of households from being eligible is that they must have a child in their home under the age of 17. And the maximum amount that we can assist with that program is $300. We all know the average median income for rent here in Pitt County is approximately $625, but that is based off low to moderate income housing. So even with that program, we're not able to reach as many people. So with those ARPA funds, one of the things that we eliminated is that requirement to have a child in the home. And also with the 200%, you have to be working or at least lost employment within the last 60 days in order to be eligible. So if you have someone that's on a fixed income or who's disabled and they're not able to meet their rent, as we know the cost of rent has increased tremendously over the last couple of years, we were not able to assist them. But with this ARPA funding, we were able to assist a lot of those individuals. So I'm very excited about that, and hopefully we can find some more money out there somewhere to help us again next year, because the need is continuously growing for help with eviction.
Is there a someone in your unit who looks for grants and stuff? Because ARPA funds are not going to stay here, you know that.
No, I know.
And it was generous that the planning department did share their leftovers or found some way to share in what they do with their needs. So you were just fortunate this time. So if you could start looking for other sources for money, that might be good for you. Even some nonprofits who help with that cause.
There are some community resource programs that if we're not able to assist households, we refer them to those organizations, and a lot of times they are able to assist.
That's what I want to hear.
Yeah.
Mm-hmm. Thank you.
Non-emergency medical transportation, fiscal years from July the 1st, 2023 to June the 30th, 2024, and as of May the 31st, 2024, total round trips was 35,586. One-way trips was 307. Reimbursement was 1,599. Cancellations was 4,333. A total request of 40,184. And that was why non-emergency medical transportation.
I have a question. I'm not trying to put you on the spot, but I'm going to ask some questions so that the general public will know some of the things that when they say there was a cancellation in your non-medical. Do you find out purpose or reasoning or whatever?
It depends. Sometimes those cancellations, the participants will actually call us to let us know that their appointment was canceled. Some of those cancellations are ones where the vendor will actually go out to their homes and the participant is not there, doesn't want to go for whatever reason. So that is a combination of both. Unfortunately, when they do have, if they notify us of the cancellation, we can notify the vendors immediately so they don't waste their time, because unfortunately the state will not pay vendors for cancellations.
Do you sort of have a way of keeping up with that? Because that can impact. I'm not trying to give you more work.
Keeping up, yeah, I mean, we have a transportation system that keeps up with all of our cancellations and things of those. So we have those reports that we can draft.
And who assessed those cancellations or as to causes, and how can we improve, or was it the fate began?
Well, we do assess those, but most of them, I can tell you, are cancellations that they will call us ahead of time to cancel. It could be that appointments were rescheduled. It could be that many of them have serious illnesses. They may be in the hospital for whatever reason. So there's a variety of reasons why those may be canceled. But we do assess those. I can't say, I don't know of anyone right off top with looking at the reports that we may have one participant that just deliberately or continuously cancel appointments without notifying us. We don't have any of those, because most of the people that we service are those people who are in desperate need of transportation. Okay. And we do transportation outside of Pitt County and outside of the state if necessary. It has to be medically necessary, though.
Thank you.
And my child support supervisors are not able to be with us today, so I will speak briefly on child support services. And child support services, pretty much, we locate non-custodial parents, establish paternity, establish court orders, and enforce those court orders. Our incentive goals are federal incentive goals that are required by the federal government, and that is how we receive our performance determines how much incentive money we receive. And right now, as of May 31st, we are on track to meet all of our goals. The only one I'm a little itchy about is our payment to arrears. Hopefully we will meet that, because of course we only have one more month, and that's June, in order to reach that goal. But all of our other goals, paternity, percent of cases under order, our collection rate, and our total collections, we are on track to meet those for the fiscal year. And our next set of goals is our self-assessment. Those are goals that are designated by the state, and we are currently excelling in all of those goals in the child support division, and you can see the report there, how we are excelling there. So again, I salute to the staff and supervisors of Family Support Services for all of their hard work. And I am very appreciative of all that they do, and I will answer any further questions.
Have any questions for Sonia or her team?
Under the self-assessments, you're meeting them.
Yes, ma'am. Under self-assessment, yes, ma'am. No, we're exceeding in all of them. If you see the column that says May 2024, that is what our current score is. And under goal, that is what the state goal is. So we are exceeding all of those.
Okay. Because this is where you may come in with getting fines. Am I correct?
Yes, ma'am,
That's
correct.
what I'm looking at.
Well, not really fine. We don't get as much.
Fees or whatever.
We don't get as much incentive money to be able to use towards, equipment. Child support receives 66% reimbursement from the federal government. And again, that is also, we also receive incentive money, which is based on our performance. So yes, if we don't meet those goals, we don't get that additional money to assist us with different things that we require, such as service of papers, paying deputies to serve papers, filing court actions. All of those are fees, paternity fees. All of those are fees that are incurred by the county, but we're able to use our incentive money to help offset that cost.
And
so
you
that it's
look
not
over those and check them out, don't you?
Yes, ma'am.
I thought I'd figure out what you do.
Yes, ma'am.
Thank you.
Okay.
Thank you, Sonia. Those actually were some outstanding reports by your department. I really appreciate you all.
Thank you.
Next, we're going to have economic services update.
Good afternoon. In your board packet is the Medicaid expansion applications report and the Medicaid report card from May. During the month of May, we received applications from 922 individuals for Medicaid, and we processed 1,087 individual applications. And at the beginning of June, we had 1,785 pending Medicaid applications. The report card for the month of May, the disability applications, the percent processed timely is 77%, and all other Medicaid applications, the percent processed timely, we're at 53% for the month of May. I will share that our waiver for March 2024 has been approved by Health and Human Services, and we have waivers for April and May pending. And I'd like to thank the staff that are working with us, that are carrying this work. We do appreciate the work that they're doing. We are continuing to fill positions. We are expecting on June 24th, 12 new caseworkers. All of them are caseworker positions, so you should see them at the next board meeting. We are also using a specialized staffing agency that already has people who have skills in Medicaid and food and nutrition services casework, and we're utilizing them to also assist us. The number's going down for Medicaid, but with the additional assistance and new staff coming in, we will eventually get where we need to be with this. But the good news is the number's going down. It's just not happening as quickly as we would like it to happen. I'd also like to thank the program managers and supervisors for all the work they've done recently in the interviewing, making the recommendations, and getting the positions filled. That process is going very well. And also the trainers, our in-house training program. The trainers, all of these folks that are being introduced to you are all going through our in-house training program. So they're also involved in the onboarding process. I'm happy to answer any other questions you have.
Have any questions for Brian?
No, I'll just, if it's okay, I'll make a couple of comments.
Sure.
So when looking at these numbers, and Brian, you probably have a better idea of when our overtime was cut. So paid overtime. And so our income maintenance folks that were doing the Medicaid, if they wanted to work overtime, they could only accrue comp time and not paid overtime, although we've had the funding for it. So I thank the county manager for reinstating that, and I think that's helped.
It is helping.
You know, it's not that people work an 8-hour day, but to have a few extra hours each day from them to be able to get these numbers down. And Expansion Solutions LLC is actually a company by a former director, and so she's very on top of who she hires, make sure that it's folks that have the experience. And so I think currently we have 15 of those to help with Medicaid, and then an
Yes.
additional 5 to help with food and nutrition. So that's in addition to any overtime that our staff works. So our numbers will get better.
Thank you.
Great, thank you, Brian. All right, next we're going to have the director's report.
So just a couple of things. June 14th is World Elder Abuse Awareness Day. We are going to have a walk that will begin here at the county office building at 8:15. We're going to be walking up towards Bee's Barbecue and going by several of the skilled nursing facilities. Hopefully folks will be outside to cheer us on, but to celebrate the work that we do and the folks that we serve. Also on Route 11, there's a billboard talking about the elder abuse awareness, so very proud of the staff. The other thing that's this month is Fatherhood Awareness Month, and I bring this forward because I think oftentimes we do not give our fathers enough kudos for how they're participating in their child's life. I just know through child welfare that dads aren't always looked upon in a positive way, but they absolutely are an integral part. And if you know anything about child development, having a dad in the picture really truly makes a difference. So although it's not our proclamation, I did want to read this on behalf of Pitt County Department of Social Services. So this is a proclamation for Fatherhood Awareness Month. And it says, whereas fathers are vital in bringing up their children and ensuring their healthy development and well-being, and whereas research shows that a father's involvement can lead to a positive educational outcome for their children, and whereas with fathers actively engaged, children are less vulnerable to mental illness, juvenile delinquency, youth sexual activity, teenage pregnancy, substance abuse, childhood poverty, and failure to complete high school. And whereas, according to the U.S. Census Bureau, approximately 1 in 4 children live without a biological step or adoptive father in the home. And whereas North Carolina is leading a kinship first culture with local and state agencies and communities to produce better outcomes for children. And whereas the state of North Carolina encourages service, civic, and religious organizations, as well as child welfare agencies, courts, schools, businesses, and individuals to join in commemorating Fatherhood Awareness Month with appropriate ceremonies and activities that recognize the importance of supporting fathers of children and youth in our communities. It says, now I therefore, Roy Cooper, Governor of the state of North Carolina, do hereby proclaim June 2024 is Fatherhood Awareness Month. So I just think it's a huge part of the work that we're to do and how important it is fathers are in the life of their children. And last but not least, just want to go over our vacancies. So in economic services, we currently have 23, however, 10 hires are in progress. Family support services, we have 2 vacancies, 1 hire is in progress. Child welfare, we have 11 vacancies. 2 hires are in process and actually started on June 3rd. Adult services, we have 2 vacancies, no hires in process. In fiscal and admin, there are 3 with no hires, and in legal, we don't have any vacancies, and of course, no hires in progress. So we're making great steps in getting those vacancies filled.
I thought Pitt County was the best in the East and a leader in the state. Why don't we have some hires in process?
So, Miss Mary, you know, I told County Manager Gallagher, that's not good enough for me. I want to be the best in the United States and the leader in North Carolina, and we're going to get there.
Okay, I just thought I'd
Yeah, that's
tickle you about
I
that
know.
because we do have a lot of people coming into this area that we can't find housing for them. So, I don't know what we can do about it, but at least these are not high.
Correct.
At least these are not high.
I will just say that staff are really trying to get ahead of this and hire people. But also, I guess the point I want to make is it's one thing to hire someone to come in to do this work. It's another thing to support and mentor and coach them, because none of this work is easy. And so I think that's in some of our areas where we've had continuing vacancies, actually putting in place a training team. So when we bring somebody new in and they go through, for instance, their pre-service training, that they're not instantly given a caseload, that we work towards getting them trained and bringing their caseloads up gradually to be able to support them. Because even a pre-service training for 6 or 7 weeks isn't going to connect all the dots for them, and to have ongoing mentoring. And that's our plan, to try to keep people in place.
Thank you. Any other questions for the director? All right, next we're going to have a couple of items for decision.
Yes, so Shantae Carson, our links coordinator, was unable to attend the meeting today because she is gone to a conference. So she asked me to present on her behalf. She, again, is our links coordinator. Links is one of our foster care programs. And each year, they take this trip, and it provides the youth an opportunity to network with other foster children, and will offer training for the social workers and staff that attend. This is being held in Orlando, Florida in August. She is needing board approval for this and to use the links funds. And also, once this board approves, then it will be sent to the county manager for out-of-state travel approval.
Okay.
Gosh, that's gonna be a hot town in Florida. Oh, Lord.
So what do we
I
need,
like
motion?
to
need a
give
motion, yes,
our-
sir.
I make a motion that we approve the request for the trip to the National Independent Living Conference.
A second.
Second.
A second.
Okay. All in favor?
Aye.
Aye.
Thank you.
Okay, the next item we have is the appointment to the Social Services Board. So this is Vice Chairman Catherine Nelson's last meeting with us. Her term expires on June 30th, of the end of this month. She has served the max amount of terms that she can serve. So per the board's direction, I submitted an advertisement for this vacancy and only received one application. Miss Sue Ann Hilgreen, who is here with us today, has applied to serve on the Social Services Board. So we just need a motion to approve her to serve a full term that expires June 30th of 2027.
I think all the board members have.
Yes,
seen-
oh, and it's, her application is in your packet, and I also sent an email out, sometime last week with her information on there.
All right.
This is, the board's appointment, you know, we have different slots.
Yes.
Yes, this is
This
this board,
board's-
yes, ma'am.
I make a motion that we appoint Sue Ann Pilgrim to the Pitt County Department of Social Services Board of Directors.
I second that motion.
All in favor?
Aye.
Welcome, Ms. Pilgrim. She can come up and.
Would you like to come up and say a few words, or put you on the spot?
Nothing other than just thank you. I'm very, very grateful for the opportunity, for sure. Sad to see Catherine go, though.
Thank you for stepping up.
Thank you. All right, next, do we have any board member comments?
I would like to say that it's been such an honor to serve on this board for the last 6 years. 6 years.
It might have seemed like 8.
Yeah, 2018, I think, is when I came on board, and
At least you didn't say a lifetime.
yeah, yeah. And I've learned so much, and I'm going to miss it, but I think you'll be in really good hands with Sue Ann. So thank you.
But you will be at our July meeting, right?
I'm going to try.
Okay, all right.
All right, I'll just reiterate again the outstanding report by the Family Support Services. I do remember, a year ago and hearing some of the challenges, and then back in October, the presentation. And it's just great to see how some things develop. Oftentimes, again, people may have the wrong impression of DSS, but, I appreciate you guys actually telling the story positively. That way people can hear what you're actually doing, so I appreciate it. All right, at this time, we're going to go into closed session.
Yes, sir, and I will read the general statute. So, it is suggested that the board go into closed session to consult with the attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body, which privilege is hereby acknowledged. General policy matters may not be discussed in a closed session, and nothing herein shall be construed to permit a public body to close a meeting that otherwise would be open merely because an attorney employed or retained by the public is a participant. The public body may consider and give instruction to the attorney concerning the handling or settlement of a claim, judicial action, mediation, arbitration, or administrative procedures. If the public body has approved or considered a settlement other than a malpractice settlement by or on behalf of a hospital in closed session, the terms of that settlement shall be reported to the public body and entered into the minutes as soon as possible within reasonable time after the settlement is concluded. So just need a motion to go into closed session.
I make a motion that we go into closed session.
I will second the motion.
Thank you.
Okay.
Commissioner.
I missed the comments at the end, and I want to say that in looking through my package, I like the changes. When someone does something that makes me happy and they're in a certain level of position, I like to publicly let people know that I noticed that the differences and statistics help makes the story. I do read statistics, and it gives a better picture than a verbal conversation. I like the style of the changes so that the person actually is supervising, tells the story, and makes the report. And I know I was out the last time, and I must say that my surgery with my eyes was endearing, but I can say that now as I look out, I can see all the way to the wall. And I appreciate all the efforts you did with this. And thank you so much. But I want to view it because a lot of things are happening over there. But I like to see that you are leading the organization. Thank you.
Thank you. Any other?
Motion to adjourn.
Second.
All in favor? Stand adjourned.